Welcome back. We're now open to calls from you with your questions and, of course, tweets. You can call us on 0808-054-2233. That's 0808-054-2233 and tweet at CTV_Mary A. While we go on with our questions, so many effects, so many uncomfortable things. Yes. You know, one at a time could be bearable, but all those things happening to a woman, hot flashes, irritability, lack of sleep, you know, it could be a bit overwhelming. Yes. You were mentioning something about reporting, you know, these symptoms, and more of it is done abroad. Is it then something that a doctor can help a woman with?
Oh, well, usually women present with various symptoms. Like I said, you know, in the advanced countries, you see a woman come because she feels she's having menopausal symptoms. She knows what she's having, and of course she reports. Of course, 9 out of every 10 women that experience menopause, we have symptoms.
Okay.
But it depends on how you are, or how that symptom is affecting the quality of life. But in this part of the world, sometimes they present with something they think they will have presented to somebody else thinking it's something entirely different.
Yes, lots of people wouldn't know.
So they don't present to the gynecologist, unlike what happened abroad. So they present somewhere else. Of course, it's usually when they present to another physician that look at them and is not finding anything after carrying out a whole lot of investigation, and they've not found anything, that they will now say, okay, when was your last period? By the time they ask, of course, it points them in the direction of the possibility of them having experienced menopausal symptoms. That's when they refer to us. But you hardly see a woman in this part of the world that will come because she's having menopausal symptoms. But of course, it does happen, especially for those that are highly enlightened. Of course, maybe they go to the internet, they read a lot. Of course, they will come. And in such situation, we counsel and provide the appropriate treatment to make life.
Okay, before we go to the appropriate treatment, Sonia, Easy Sonia, is asking if menopause can occur before the age of 30. We have to quickly answer that because the call is coming in. Can it happen before a woman is 30?
It can happen.
Okay, so let's take this call first. Hello.
Hello, good afternoon.
Good afternoon. What's your question?
Yes. I was watching your program and I was talking about the menopause age. I want to ask the doctor because I've been noticing from he's going through nurses. Hello?
Yeah, you've been noticing?
If I have a message every month, that is not the following month, maybe it reduces by 5 days, at times it reduces, the date is not equal. Does that mean someone is having menopause?
Okay, first of all, I'm sure probably you'd want to know
like
her age.
I mentioned this earlier. That's the most important thing, is to know her age. Like I said, there is what we call a menopausal transition, or what we call climacteric period. That period is a transition. Menopause has not totally occurred. That means for us to define a woman as being menopausal, she must have stopped menstruating for 1 year.
12 months.
But leading to this particular period, she will be experiencing some menstrual irregularity.
Okay, so there's something like a prodromal thing, in which a woman has a warning.
That is
it's coming.
Yes,
it's coming.
So usually that is characterized by what we call polymenorrhea. Polymenorrhea means the cycle length is shortened.
Okay.
Understand? And that is because there are two phases of a menstrual cycle. That's what we call follicular phase and luteal phase. Because the follicles are depleted, that follicular phase is shorter. Ideally, it should be about 14 days. But of course, because follicles are shortened, less are recruited. Okay. So it can become 10 days, can become 9 days, 8 days.
That's
so
really
the total
short.
Cycle length would now be less than 25 days, usually in most cases.
Okay.
Yeah.
Now, somebody is still asking, can something be done to reverse early menopause? The early
sometimes
one.
Yes. Sometimes part of what can result in early menopause is undernutrition or malnutrition. You know, some people are also athletes. You know, because athletes, of course, you need a certain body mass, a certain body fat to be able to sustain menstrual flow.
Okay, we'll come back to that. Okay. We have a call coming in. Hello. Hello.
Hello, good afternoon.
Good afternoon, Tunde. What's your question?
My question is, what normally causes for a woman to stop menstruating at the age of like 30 years, and she will not menstruate throughout the maybe 50 years? So what normally causes?
Okay, thank you, Tunde. We will attend to that.
Okay.
Well, first of all, it seems to me you said something about autoimmune problems being one of the things that could cause an early menopause.
Yeah, exactly.
What are the other things?
Well, like I said, there can also be some medications. A woman that has cancer that is taking chemotherapeutic drugs. These are drugs we use in fighting cancer. This drug, apart from fighting the cancer cells, of course, they have very, very low memory. They can also be fighting normal cells in the body. And part of the cells they'll be fighting is the ovary. So in the course of fighting the ovary, they deplete the follicular count of the ovary. Of course, other drugs like drug they use to treat thyroid diseases, anti-thyroid agent.
So there's a whole lot that can cause early menopause.
Yeah.
But then you were mentioning athletes, you know.
Yes, because there are some athletes, of course, when they can experience what we call the early menopause or cessation of menses, because usually there is a depletion of their body fat. You need a particular percentage of body fat to be able to sustain menses. So such people, because of loss of body fat, they can also experience menses.
Okay. Is there a way for medical personnel now to, in that case, increase the body fat for that person? Or I'm talking generally about things that can be done to ease that phase.
Okay.
Make it more comfortable, make it more bearable.
Yeah. Like I said, of course, apart from the fact that menopause is multisystemic, is multidimensional, the management is also multidisciplinary.
So she's going to be seeing many doctors just because of it.
Sometimes the effect may not just be, it may be psychological. Psychological, as a gynecologist will not be able to provide the psychological counseling. And of course, I may not be able to provide the dietary counseling or dietary intervention. So of course, a whole lot of other people, gone are those days when only one person say, I'm the only one that can do it.
Yes.
Of course, you have to do it in conjunction with other healthcare practitioners. So somebody that is experiencing symptoms, psychological symptoms, such as inability, loss of sleep, depression, anxiety, such people can be managed by a psychologist or a psychiatrist. Somebody that is, of course, because you want to control their diet, so that they eat diet that is also menopausal friendly. You also need to the intervention of a dietitian to also come into play.
But what about hot flashes? Can that be attended to? Because I think that is one of the most common things that happens to women. They get hot, suddenly they are cold, then they wake up, the sheets are wet. Is there something that can be done for them? Yes, something can be done. The first line treatment modality for menopausal symptoms is what we call hormone replacement therapy. In which case, we give them either estrogen alone. We can replace the estrogen they are not getting from their body anymore. So we can give them from outside. We can give a combination of estrogen and progesterone, because estrogen alone sometimes can have its own health effect. So you can give in combination with progesterone to militate the effect of that. Then of course you can. So when you give a combination of such drug, it can help to, of course, to relieve the symptom. But because a lot of some women know that sometimes hormonal therapy can have its own health consequences too. Okay, we have some side effects.
We have alternative that we can give. For instance, so we counsel them about lifestyle modification. If a woman is smoking, we tell her to, of course, to either reduce smoking or to stop completely. If that can be done, it's better to stop.
These are now lifestyle changes.
If she cannot stop, of course, you can reduce. She's taking 5 per day. We can tell her to reduce it to 1 per day. Of course, alcohol consumption, use of caffeinated drinks. Somebody that takes a lot of caffeinated drink, I tell her to reduce it. And of course, you can also use we can advise them about exercise. There's something we call weight-bearing exercise. Exercise like walking, jogging. Nothing too serious, just mild exercise. That will just last for about 30 minutes per day. Okay, we have a call coming in. Hello.
Yeah. Hello.
Hello. What's your question?
Good afternoon.
Good afternoon.
Yes, I want to ask the doctor. Hello? Hello?
Hello, go right ahead.
Okay. Please, I want to ask about this late menopause.
What about it?
Okay. I'll give you myself as an example. By December, I'll be 60 years.
Okay. So you just want to know what kind of things you should be facing, what you should be thinking about.
Right now, I'm still menstruating.
Okay. Okay, thank you for that question. What are the implications for her? Let's do that in 1 minute.
Okay. She said she's 60 or 50?
60, and she's still having periods.
Okay, 60, that is a cause of concern. Not that it's totally impossible, but of course the average duration where we expect normality to take place is between 45 and 55.
Okay, so
but if she had experienced a
doctor?
stoppage of period, sometimes they think they are menstruating. Sometimes some women will have experienced a stoppage of period for 1 year.
Should she see the doctor?
Seeing period, she should see a doctor.
Okay.
And of course they will carry out the next treatment. She should see a gynecologist.
All right, a gynecologist.
Yes.
Thank you so much for coming. That has been so interesting. So many calls. Thank you for staying there with us, and have a great day. I am Mary Alale Yusuf.